Hi, my name is Ruth. I work for Prestige. I've been with the Prestige since 2014. I'm a nurse, and right now I do authorization, I do scheduling, I do payroll, and I coordinate the patient and the staff out on the field. I deal with ASAP programs too. We have three ASAP program. I deal with that too, with the coordination of the staff and the ASAP programs. Um, I'll start with the scheduling. With the scheduling, we do schedule patient according to after the start of care, depending with how many frequencies they have. Usually, that all depend from the start of care. And the main thing with the scheduling is like we require the staff to work every other weekend. We require the staff to be compliant. If you cannot be able to see a patient due to any reason, you need to call the office instead of calling the patient. So the office have to call the patient and notify the patient. The other thing is when it comes mostly with the home health aid, you cannot document more hours than what is being authorized. If the patient have only 2 hours, you can only stay at patient house for 2 hours. If for any reason you're not there for 2 hours and you leave before your 2 hours, you have to document the time you left the patient house. The other thing is about talking to the patient about what's going on with your personal life. We usually don't recommend that. We like if you have an issue or something is going on that you're not happy, it's nothing to do with the patient. You should come back to the office and talk to the office staff. When it comes to basically scheduling is a whole main thing, and if you cannot see a patient for any reason, like if the patient is 3 times a week and you didn't see the patient like on Monday, we can always reschedule that patient for Tuesday, and you need to call the office and let the office know so we can contact the patient and see if the patient will be available Tuesday or Wednesday or Thursday or another day so you can make it up the visit for that week. When it comes to the nursing is the main part. With the recertification, it have to be done on time because without having the recertification done on time, we kind of hold the care for the patient because we don't know the frequencies for the next episode. So we always ask the nurses to finish their notes 24 to 48 hours. The same thing with the home health aid. Like the notes have to be completed 24 to 48 hours for the continuation of care. Um, the other thing is, we'll talk a little bit about authorization. I'll let Monique start.
Hi, my name is Monique. I've been working with Prestige Healthcare Services for a little bit over a year. I do authorizations, I help out with intakes, and I also do the billing for the three ASAP programs that we have here at Prestige. Um, when it comes down to authorization, as Ruth said, it's very important to make sure you have the notes done within 24 to 48 hours after the visit is complete, not on Monday of payroll week. We also ask that the date you are signing is the date that the visit was scheduled, and again, make sure you're putting in the correct in time and the correct out time to match the authorization that was authorized for those units. We will send out the authorization a few days before the authorization is ending, and we need all notes for the 2 weeks prior to the authorization ended. They all needed to be completed, signed with the correct hours for in and out. And that goes for nursing and home health aides, as well as the recertifications, any physician's orders. If there was any admissions to the hospital, we would need to submit that documentation in as well. If the doctor is asking for an increase in services, we would need a physician's order stating why the patient needs an increase in services, and services will not be increased until authorization has been approved from the insurance company.
So when it comes to authorization, we usually do justification. We have to have a reason why we are seeing this patient. And if, for example, we are going to see patient because they are of diabetes, we need to document what we are doing for this patient. What are we teaching? What is the goal toward the patient being independent? But the main thing is we have to justify why we are going to see this patient every day or how many times a week we are seeing the patient. So for every notes that the nurses document, they have to be really specific why we are seeing the patient. If the patient have a home health day, they have to be documented why, how come this patient cannot do their own ADLs, and why do they need a home health day to do the ADL. So that's a very important piece when we are sending all these notes to the insurance company. They need to see that we are teaching our patient to be independent, not to be dependent on us. We have some patients who have psych issues. There's no way we can make psych issue patient to be independent. But yeah, we have to assess for the basic stuff about their mood. Are they compliant with the medication? So those are the kind of stuff that we really need to see on the nurses notes, and to see that we are making an attempt of making our patient independent, but it's not all patient that they can be independent. But as we say, the notes being on time, it matters a lot. It is a very big piece with our agency, because we need that to be on timely manner so we can be able to complete everything. Because for authorization, it goes from being the start of care to the order being signed by the doctor and the notes. If we don't have all those items, there's no way we can be able to do authorization. The other thing is about the patient, like if the patient have reached their goals, we always need to cut them down, or to add discharging them. We have some patients who do very well with the teaching, and now they're independent, so we don't need to keep them in service. For us, we can always justify with that, like if the patient is able to do their own meds without the help of the nurse, or the patient is able to check their own sugar and be compliant with their insulin and all that. The other thing is about the patient that we see because they're diabetic and we do the insulin. We have to document the reason why this patient cannot administer their own insulins. We have some patients who can do it, we have patients who cannot do it. So if that's the reason why we are going, this is a long-term disease that we cannot say the patient will get better. But at the same time, it's about what are we doing for patients to reach the goal of being independent. So documentation is the key thing with authorization. I'm going to talk a little bit about payroll. Our payroll is every 2 weeks, and when we do the payroll, we close payroll Monday at 5. Any notes that are submitted after Monday 5 p.m. on the payroll week is not gonna get paid until the next 2 weeks. We do payroll every 2 weeks. So if you're late with your note, you have to wait for 2 more weeks to get paid, and that's something that we really follow. We require the notes to be done on databases, and the latest is 24 to 48 hours. That's what we require.
For ASAP patients, we will not be having the patients on access, so you would need a timesheet to come in and put into the office. We will only be accepting those in person. We will not be accepting them dropped off by anyone else, or faxed or email. You would have to bring those into the office the Monday of payroll before 5 o'clock. The date will always begin on a Sunday and always end on a Saturday, because that's our pay period, Sunday to Monday. If you're scheduled to work with the patient on a Monday, Wednesday, or Friday, you still need to start the week with the Sunday date, even if you did not work on Sunday. They have to be readable, have to be signed by either the patient or the person that is authorized to sign the timesheet on the days that you go and work with the patient. And it also has to be done in blue or black pen. We will not accept a timesheet if it's written in pencil. And again, if you submit the timesheet after 5 o'clock on Monday, you have to wait the following pay period to receive your paycheck.
We look forward coming and join our company, Prestige Healthcare Services. We've been in service for a couple of years, and we'd like to welcome you aboard. And we hope you're going to be valuable to our company. And welcome.